My name's Melissa.
And I'm Tracy.
And we're therapists in the Joint Replacement Center of Excellence. In preparation for your surgery, we'd like to show you some exercises. We'd like you to start now.
Strengthening your muscles as best you can before surgery will help you recover faster.
We will start with exercises to help strengthen your arms prior to surgery. You will be using your arms after surgery more than you may be using them now. So we've chosen certain exercises to target certain muscles. The first arm exercise is a seated push-up. To complete a seated push-up, you will need to identify a stationary chair that has armrests. Sit with your bottom close to the edge of the chair, with your feet out in front of your knees. Place your hands on the armrests. Slowly raise your bottom up off of the chair by pushing with your arms, like you are going to stand up. Then lower yourself back down until your bottom is resting on the chair. This movement should be slow and controlled, and you should pause briefly on the chair in between each lift. The goal is to perform 10 repetitions 3 times a day. If you do not have a stationary chair at home, or you have a shoulder injury or any pain while doing this motion, we'd like to recommend a second exercise instead of doing the seated chair push-up. For the elbow extension exercise, you will need to identify something you can hold in your hand like a weight. If you have a dumbbell at home, that's great, but if not, you could hold on to a can of soup, beans, or a bottle of water. Lay down on your bed and hold the weight in one hand. Raise your arm up towards the ceiling and use your other hand to support your elbow. Slowly bend and straighten your elbow. Once you have completed 10 repetitions, switch the weight to the other hand and repeat. Try to hold enough weight in your hand that by the time you have completed 10, your arm is tired. If laying down is not comfortable for you, the same exercise may be done in a sitting position. Just be sure to keep your elbow pointed straight up towards the ceiling while you are bending and straightening your arm. The goal is to complete 10 repetitions on each arm 3 times a day. Next, we will show you some leg exercises. These leg exercises should be done on a bed or elevated surface. The goal is to perform 10 repetitions of each exercise 3 times a day. Let's start with ankle pumps. To complete ankle pumps, you will point your toes as far as they will go and then pull your toes back until you feel a nice stretch in the back of your lower leg. This should be done at a slow and consistent pace. Remember, 10 repetitions 3 times a day. Another leg exercise strengthens your quads. Your quads are the large muscle group on the top of your thigh. To complete quad sets, tighten the muscles of your thigh and push your knee down towards the bed. Hold for a count of 5 and then relax. Do both legs together and be sure to keep breathing in and out while you are exercising. Your next exercise is a gluteal set. To complete this exercise, tighten your buttock muscles, hold for a count of 5 seconds, and relax. Heel slides are performed one leg at a time. Slowly slide your heel up towards your buttock as far as you can comfortably. Try to keep your heel in contact with the bed. Your movement should be done at a slow and consistent pace. Once you have completed 10, switch to the other leg and repeat. If you are having a hip surgery, your next exercise is hip abduction. When doing this exercise, keep your knees and toes pointed up towards the ceiling. Slowly, slide your leg out to the side as far as you can comfortably, and then back to the center. Keep your leg supported on the bed while sliding your leg. Do not lift it up off of the bed. Some patients report that this exercise is more comfortable in a standing position. Just be sure to hold onto a counter or railing for support. If you are having knee surgery, your next exercise is a straight leg raise. This is also performed one leg at a time. Bend up one leg in the bed to help support your low back. Keep your knee straight on the leg you are going to lift. Raise it up off of the bed, no higher than the level of the opposite knee. Pause, and then lower your leg back down to the bed and relax. Movement should be slow and controlled. Once you have completed 10, switch to your other leg and repeat. For this next knee exercise, you will need a rolled up towel or blanket. Place the roll under your knees. Slowly, straighten and bend your knee over the roll, one leg at a time. Relax your muscle in between each lift. Be careful not to lift your thigh up off of the roll, and once you've completed 10, switch to the other leg and repeat. This completes the leg exercises you'll need to practice prior to your surgery. If you're having a knee replacement, there is one more exercise called prop knee extension on the exercise page. This exercise is for after surgery only. As you review your patient resource guide, there are advanced exercises listed for you. You do not need to complete these exercises before surgery. We will progress to these exercises during your recovery. Remember, with the exception of the propped knee extension exercise, these exercises are to help you prepare for surgery. Do what you can, and if you have any questions about these exercises, please discuss with your surgeon. Patients undergoing a total hip replacement will have hip precautions after surgery. These are movements you will want to avoid temporarily during your recovery. Your specific hip precautions will depend upon the surgical approach used by your surgeon. We will introduce both types of approaches. Talk to your surgeon about the specific approach that applies to you. If your surgeon uses a posterior approach to replace your hip, you will have posterior hip precautions. These are listed under the Precautions and Positioning section of your Patient Resource Guide. There are 3 movements you will need to avoid after surgery. First, do not bend your hip past 90 degrees. Second, do not cross your legs. Third, do not turn your leg inward. Some tasks will need to be modified to allow you to be independent after surgery. For example, reaching down to your feet to put on your shoes and socks. The adaptive equipment for dressing will be an important part of your recovery. Tracy is demonstrating how to use the sock pull to put on her socks and the reacher to position her shoes to allow her to be independent with this activity. If your surgeon uses an anterior approach to replace your hip, you will have anterior hip precautions. These are listed under the Precautions and Positioning section of your patient resource guide. Do not do any activity that extends your surgical leg far behind you. For example, taking a large step, or if you are standing or walking and your leg is slightly behind you, do not turn away from your surgery leg. If you are in bed, do not reposition your bottom with only your strong leg, or drop your surgical leg off the bed before sitting up when getting out of bed. As you go through your patient resource guide and read about how to get in and out of bed, stand up and walk, or get in and out of the shower, we have highlighted how to do these and maintain your hip precautions. Practice these tasks as we've described to prepare for your stay in the Joint Replacement Center. For all joint replacement patients, if you are able to ensure that whatever you are sitting on is tall enough so that it hits you slightly above the bend of your knees, it will be easier to sit down and stand up and safer for you after surgery. During your physical and occupational therapy sessions in the hospital, you will have an opportunity to practice with the adaptive equipment you have seen in this video. We will make sure you can properly perform your exercises and safely do what you need to return home. Joint replacement is an elective surgery. Your exercises and preparation prior to and after surgery will help you get home faster and speed your recovery.
While you're in the hospital, we will be with you every step and give you the tools you need to recover further at home. We look forward to seeing you.